Hi, and thank you for joining us for our first Evaluate Vantage podcast. My name is Jo Fagg, and I'm the Content Manager for the Evaluate Vantage team. Today, I'm joined by Lisa Urquhart.
Hello.
The editor of Vantage, and we're going to be talking about what we see as the catalyst for the pharma and biotech market in the third quarter. Since you're here, you're probably familiar with Evaluate Vantage, but if you're not, you can subscribe to our daily email alert, so you'll receive our take on the latest news about the pharma, biotech and medtech world, with Evaluate Pharma's data to add depth and context.
So thank you for that great intro, Jo. So on to the topic of the day. What are the catalysts that will be driving the third quarter of this rather inauspicious year? The first half of 2022 has seen a continuing bear market, a rather downbeat ASCO, and most recently a spot of bargain basement style buying of small biotechs for sums of money that frankly would have made them weep 2 years ago. So this is the environment that biotechs are operating in, but what's coming down the pipeline in the next 3 months might help change the fortunes of some of these businesses.
First up, we're going to be looking at some big pharma catalysts. And while COVID may have dominated the vaccine headlines for Pfizer for the past couple of years, this time we've got some pneumococcal vaccine data coming up. We all know the company's Prevnar franchise is the big seller, but just a couple of weeks ago, Merck actually gained a slightly upper hand in the infant market because it got its approval for its 15-valent offering Vacnuvance. This is something that Pfizer's 20-valent vaccine Prevnar 20 doesn't yet have.
This obviously sounds quite important for people working in this space. Just how big is that childhood market?
Yeah, it's huge. It makes up a big chunk, 80% of sales. And Pfizer have got data from 3 global infant phase 3 studies coming up in the second half. But the next battleground will be increasing the number of valents. So actually increasing the number of serotypes protected against. We've got Merck, Vaxcyte and now GSK all having contenders in clinical studies. So speaking of GSK, we've got data from its anti-GM CSF mAb, otilimab, with data coming up in rheumatoid arthritis. Now, this mechanism of action has had several setbacks in RA. We've had discontinuations from Humanigen, Roivant and Kaninska. In otilimab's own phase 2 Baroque study, the highest dose actually missed the primary endpoint. That was the disease activity score. But it did claim a benefit on ACR 20, which is a 20% improvement in the American College of Rheumatology criteria. Now, that ACR 20 is now the primary endpoint for the 3 upcoming clinical studies.
Jo, it seems to me like the RA space is incredibly crowded. So, I mean, what will otilimab's results need to look like to make a difference?
Yeah, so AbbVie's Rinvoq is forecast to be the market leader in RA, and that actually showed a placebo-adjusted ACR 20 of 37%. That was across 3 studies. So that number will be what GSK needs to aim for. Another mAb we've got data coming up for is Roche's crovalimab in PNH, which is a rare disorder in which red blood cells break apart prematurely. Now that space is actually dominated by Astra-Soliris and its follow-on, or Ultomiris.
Given just how entrenched the Astra products are in this space, how is Roche going to get a foothold to actually disrupt?
So it looks like it's going convenience here. We've got 3 trials are set to report. It's a subcutaneous mAb. We've got 2 non-inferiority studies against Soliris, which is intravenous, and a single-arm trial in China. However, Roche won't have long to try and grab some of that convenience market because we've got oral products such as Novartis's iptacopan with phase 3 data due in the second half.
So basically they need to execute flawlessly here.
Yeah, indeed. So moving on to the biotech companies. First up, we've got Alzheimer's data, and despite all the setbacks and the Aduhelm debacle, companies are still trying to find an amyloid beta mAb that actually works.
I mean, seriously.
Mm-hmm.
And with all the recent failures we've had, including Roche's crenezumab, we must be getting to the end of the road with the beta amyloid hypothesis in Alzheimer's, surely.
Well, you think so, but we've got several companies still set to report data. We've got lecanemab data from Biogen and ISI. So this is the Clarity AD trial, and that is a confirmatory study. So just recently, the FDA accepted the mAb's accelerated filing and gave a PDUFA date in January. But that filing actually used a study data called 201, but that actually failed, which isn't a great omen for the upcoming Clarity AD data. Beyond lecanemab, we've got Eli Lilly's donanemab data. That is a head-to-head study against Aduhelm. And towards the end of the year, we've got data from Roche's gantenerumab. Of course, several smaller companies are also dabbling in Alzheimer's. Lisa, you looked at Anavex.
Yep, one of the industry's minnows is having a go playing with the big boys. Anavex is expecting phase 2B/3 data for Anavex 273 It's a 509 patient study lasting 48 weeks, and it'll be looking at changes in terms of cognition, which are very important in Alzheimer's, alongside other measures including changes in daily living scales. But as we all know, Alzheimer's proved a very hard nut to crack, defeating even some of the biggest of players. So it'd be huge if Anavex had success here. But what might be against them is the fact there are questions around Anavex 273 after the group earlier this year claimed success in Rett's disease, but only after they changed the study endpoints. So I think people will be looking at the data. I'm not suggesting they're going to change the endpoints, but I think there'll be a lot of scrutiny on that.
Now onto a few eye drugs. So the defences are up for Regeneron and Bayer's blockbuster Eylea. We've got a high-dose, longer-acting version in the works, and the aim here is for 12 to 16-week dosing rather than the normal every 8 weeks. We've got 2 trials set to report, the PULSAR and PHOTOS studies in wet AMD or diabetic macular edema. So the plan is to defend against biosimilars as Eylea's patents start to expire next year. And we've actually got biosimilar data coming up towards the end of the year from Amgen and Biogen. And also they need to defend against Roche's new bispecific antibody Vabysmo, which got approved earlier in the year.
So while it seems like they do have defences, I'm presuming it's not going to be all plain sailing here. I mean, there's still questions around the commercial prospects for the high-dose version, and it will need to show superiority rather than just non-inferiority to gain a foothold in the market. And I think that's particularly important once the biosimilars are available.
Yes, I agree.
Do we have any other eye data coming up?
Yeah, we've got Ivet Bio's Zimura in geographic atrophy, and results are expected from a phase 3 GATHER2 trial. So we've already got good backing here because it had a positive phase 2-3 trial already. But there's competition from Apellis, which recently submitted its own complement C3 inhibitor, pegcetacoplan, to the FDA. Now, Zimura hits C5, which is slightly different to Apellis' C3 complement inhibitor, but Apellis' own clinical program, which included later stage patients, had mixed results, but the pooled data hit.
I'm going to guess here that the risk might be that the FDA doesn't accept pooled data.
Yes, I agree there. So a couple of other catalyst mentions we've got oral selective estrogen receptor degrader, or SERD, data from Arvinas and its partner Pfizer, and also separately AstraZeneca have got data here in later line breast cancer. Now that SERD space has seen setbacks for Sanofi and Roche, but success for Radius and Menarini. Now that success was largely thanks to them enriching their data for an ESR1 mutation. So separately, we've got some TIGIT data coming up. We've got Gilead and Arcus. Now that MOA has seen several blow-ups for Roche.
If you want to read a little bit more about that, we've covered this quite extensively on Vantage. So head over to evaluatevantage.com and have a look.
So now that we've looked at some of the bigger players in the industry, it's time to turn our attention to the minnows. Lisa, what's coming up?
Well, it's interesting. If you thought NASH was dead, think again. 2 companies are reporting data in this notoriously difficult area. Intercept's expecting not 1, but 2 phase 3 readouts for its lead product, Ocaliva. First up is the Regenerate trial in advanced fibrotic NASH. And there's a lot riding on this because the company had a complete response letter from the FDA back in June 2020. And one of the conditions of the regulator looking at the data again, or even reconsidering US approval, was looking at this data. So it's really critical. The second trial, the reverse study, is in NASH patients with cirrhosis. That's expected in this half. In terms of sales, I mean, these both are important because Ocaliva hasn't really performed particularly well in its improved indication of primary biliary cholangitis. So any additional income will be welcome, and that will be dependent on actually getting approvals in these 2.
Doesn't Intercept have cash problems?
Absolutely, and that's another reason why these are even more important. Recently, the group was forced to sell ex-US rights to Ocaliva to help with its cash situation. So not great on the money front. The other NASH player reporting data is Akero. It's expecting phase 2B readout for efruxifermin. And while others might have given up on NASH, a positive result here could be very welcome because Pfizer has recently invested $25 million as part of an equity investment. So it could be argued that at least one big pharma still sees some potential here. The next company I'd like to focus on is Chimera. The Massachusetts-based company is waiting for phase 1 results for its atopic dermatitis product, KT474, which is an IRAK4 inhibitor.
Didn't Pfizer have one of them?
It did. Unfortunately, it discontinued it. And I think that the fact that they discontinued really hit sentiment with Chimera, which saw its shares go down. It looks like, I think, Pfizer discontinued because it wasn't a priority for them, but it still hit sentiment around KT474. But what also might impact the drug is the fact that the market will be looking out for a worsening of the heart safety signal that was seen in earlier trials. At the moment, importantly, it doesn't look like there's an increased risk of arrhythmia, but if that does change, it could be quite serious in terms of future development. As for efficacy, investors will be looking for similar, if not better, performance in terms of a 75% change from baseline in eczema. And that would see it match the market leader Dupixent, which would be really important given Dupixent's dominance of the market. The other company I'd like to look at is Zealand Pharma. That's expecting a readout from the pivotal EASE-SBS1 trial for glepaglutide in a long-acting GPL2 agonist in short bowel syndrome. The results are going to be the first test of Zealand's strategic shift to R&D outlicensing, as opposed to trying to take drugs all the way through to market themselves. In terms of what success looks like, Zealand will be hoping to show benefits over the market leader, Takeda's Gattex. In terms of how it might distinguish itself, glepaglutide only needs to be dosed once or twice weekly, compared with daily dosing for Takeda's Gattex. Jefferies analysts believe this and the convenience of the ready-to-use injection could ensure strong take-up. And this is going to be important because the generic version of Gattex is entering the market in 2023. I think that wraps up our conversation for today. So if you've got any questions or thoughts on what we've discussed, feel free to drop us a line or find us on Twitter, where we are at Evaluate Vantage.
So yeah, all this, we've got 3 catalyst stories, so you can find them on our Vantage website, which is evaluate.com/Vantage.
And finally, remember to subscribe to our email alerts if you're not already. And if you also want to drop us a line about things you'd like to be discussed in the podcast, let us know. And thanks for listening.
Goodbye.
That's bye from me too.